We're here in the Kakuma region of northern Kenya to support the International Rescue Committee and UNHCR, the UN agencies, to be helpful in the Kakuma refugee camps, where we just learned that there are over 300,000 people, the majority of them children. The people that are here come from South Sudan, Ethiopia, northern Uganda, and Somalia, and Djibouti as well, and have escaped conflict, primarily famine and other natural disaster. The staff here is so excited to get the CPAP devices and the package of care that comes with it. These are really nice neonatal pulse oximeters and neonatal and child. They know that it'll make a great difference in this setting, and our intention is to work closely with them to make sure every baby that's born here has access to a CPAP ventilation support device if and when they need it. We reviewed the data of the pediatric ward yesterday, and they have between 9 and 15 children under 5 lose their life every month. So that's a child under 5 every other day. And the number one reason is from respiratory failure, from pneumonia. And this device can save a large number of those children. The people who work here are incredible. The commitment of the 5 doctors and the 6 mid-level providers, they call them clinical officers, they're taking care of an enormous number of people, but do so with incredible dedication.
This is our maternity unit. It's one of the busiest departments in the whole hospital. It has a bed capacity of 42. So in terms of the deliveries that happen here, we can have anywhere from 10 to 13 deliveries in a day.
Because of the support of UNITAID and the Japanese government, this will be a demonstration program that will really showcase what we can do together and allow an opportunity in a way that others can replicate this, and this can be scaled in many, many other settings. We're doing the same in Yemen, Eastern Congo, and DRC. Very soon we'll be launching in South Sudan. Over the course of my career, I founded the Center for Global Health at Mass General Hospital, and I'm also a senior faculty at Harvard Medical School and the Harvard School of Public Health. And my entire career has been about developing disruptive innovations that can be sustained and change the lives of especially women and infants and young children. Working almost 15 years in the space of creating a uterine balloon and then a postpartum hemorrhage package of care that was adopted by WHO, and the uterine balloon now being in 120 countries, it was time to look for what's the next opportunity to really make a difference in the lives of the poor and vulnerable populations in the world. And CPAP really is an opportunity to do exactly that. In the last 2.5 years, really focused on VAIU. CPAP has been around now for about 60 years, and it's been shown to be a mechanism of supporting breathing, especially in babies, but now also in young children and now also in adults. Our target was to create a device that was extremely inexpensive, high quality, just as good as a gold standard device that we would see in the United States, but would not need electricity, would not require bioengineering support, and would be entirely reusable. Here in the United States or in Europe, a CPAP machine can cost anywhere from $8,000 to $12,000 on up. Our device is $400. At the very beginning, the National Institute of Health and then the Gates Foundation took a chance on us and gave us small grants. It took us about 7 years before we actually got there. We have just under 6,000 VAIU bubble CPAP devices currently in use. In the last 2 years, we've treated just over 300,000 babies in 38 countries. I'm really excited about where we are now with VAIU. And VAIU Africa is critical. We're expanding. They're a pediatrician, neonatologist. We're hiring 2 nurses. And the team, their entire focus is on training, mentorship, and support.
My name is Chol Makur. I work for VAIU as Senior Pediatric Advisor. My colleague sitting here is Kennedy Opundo. Is the lead for VAIU Africa. Even if they train today, in few days or few weeks, we will be also training other groups within the hospital and outside the hospital.
Yesterday, we began training, and the equipment that was sent here includes 50 bubble CPAP systems, a number of training devices, and little training babies. When I was a young doctor, most of us thought that 100% oxygen, the more, was better. And we now know that if you give a premature baby 100% oxygen, it'll hurt their eyes, it'll hurt their brain, it'll hurt their lungs. So the centerpiece of the Value Bubble CPAP system is the blender. It's entirely powered by the oxygen that's flowing through it. Its elegance is in its simplicity so that the baby gets exactly the dose of oxygen that it needs. Because of this unique setting where we can actually get data, we can show the world, look what's possible. Value devices have been treating babies and young children in some of the most difficult places on earth. Deep in the Amazon, in Ukraine, in war-torn regions. Why are we focusing our energy on refugees? Kakuma means nowhere. It's the place where people are often forgotten. Yet, being in the camp, you can see this is not just nowhere, this is home. Second to that, when you have healthier babies and healthier young children, people actually will biologically have less children. It also allows a family and a community opportunity to move out of poverty and move towards a better future. What I've certainly learned over the years is that you can't solve, or you really can't address a problem, you can't solve it from Boston. It depends greatly on finding amazing partners around the world. The other is a device alone will never save a baby's life. It requires keeping a baby warm. It requires feeding a baby. It requires giving a baby antibiotics. It requires doing some other basic things. So we've incorporated that into the training of the device. So we're not a device company. The DNA of Value is about making a difference in the world that's sustained and that is based on the deep belief that every life deserves access to quality health. Every life deserves a life of dignity.